Welcome back, everyone. With John and I love to see you curious people about ocular issues that may affect you and your family. We are ophthalmologists. We trained at Albert Einstein College of Medicine way back before electricity and plumbing. But I'm a fellowship trained oculoplastic surgeon in Anchorage, Alaska. I do neuro-ophthalmology as well. John's a cornea specialist. John, you want to say?
Hello to all of you. Yeah, I'm in New Jersey, and we're here really to talk about common eye conditions, that things that you're worried about or concerned about, and we want to try to share it in our channel. So today we're going to talk about something we hear all the time. Doc, my eyelid's twitching. I don't know why. It keeps twitching. It's going crazy. It's been going on a day, and 2 days, a week, 2 weeks. We get a call like that almost every day in my office.
Right.
So Carl, what do you do when you see a patient with that complaint?
Right. So, as an oculoplastic surgeon, I see twitching eyes for things that are called essential blepharospasm, hemifacial spasm, but that's more esoteric. We're going to talk about just regular twitching eyes, also known as myokymia, and this can affect your walking, driving, watching TV, reading. 10 people out of 100,000 can have the more serious variety, but it's very, very common. Everyone will have it during their lifetime at some point.
Have you had it?
What? I've had it. Yeah. I'm with you. Yeah.
The first time I ever had it was when you and I were working together in the residency.
Yeah.
It was stressing me out. And
you were stressing me out, bro.
now I find I only get it when I work with people I don't like. No, all serious. So the reason we're saying it, it's very common. We both had it. If you're watching this video, you probably have it yourself. I find the most common causes are people that are stressed out. Something's going on in their life that's changing their stress level. They're not getting enough sleep. Caffeine is a big one. If you're drinking more caffeine than usual, it's a stimulant and it stimulates that twitching, and then medications. But the twitching is really what's related to. There's a muscle in your eyelid called Mueller's muscle, and it's stimulated by the sympathetic nervous system. The sympathetic nervous system is what we think of as fight or flight. So anything that makes you really anxious and get up and go, not only will it affect your heart rate and make it go up, and your blood pressure and make it go up, it can actually stimulate that muscle to twitch.
Right.
So that's why when I see somebody, I really talk about what can you control. It's hard to control stress. It's hard to control sleep. Caffeine, I tell people, cut down on the caffeine. Sometimes it helps. What else do you do, Carl?
Right. So, if you're, younger guys who are working out, it can be, energy drinks can do it. I've seen guys drink, 2-3 energy drinks and working out at the gym. But, most of the time we just tell people to just relax, observation, sometimes meditation, massages, warm compresses will help it. But really just getting some sleep and cutting back on the caffeine is the main way to treat these things. You do want to look for an eyelash that maybe is triggering it. So you do want to look for some physical things that may be actually a real reason for twitching, but or sometimes.
Yeah, that's why I always encourage my patients to come in for an exam. I don't want you to treat yourself, but I think there's a very good chance once we examine you, make sure it's not something like that, and we have a conversation like this. And I think in rare cases, in fact, in my career, I've never treated it, but I know of some patients that had it for so long. They did go maybe get some medication to relax them, like clonazepam, Xanax, things like that, or muscle relaxers. But the only time I get concerned, at least for me, is if someone has it and it's not only their eye, it's their face, it's their mouth. That's different. Then I'll probably send them to a medical doctor, and that's a big workup we could talk about another time. But I think for this video, we're talking about the garden variety. Just when it's twitching your lid, it comes and goes. Right. And those people, it's generally benign. It's generally nothing to worry about.
Right. What John's getting to is the essential blepharospasm, hemifacial spasm. That is a separate workup. For hemifacial spasm, we do an MRI. We look for a blood vessel pressing on the seventh nerve, and we do treat with Botox or Zomin. And there's even a neurosurgical procedure by a guy named who described it back in 1970 called Janetta in Pittsburgh. But that's a separate topic. But we just wanted to make sure that you understood that myokymia or eyelid twitching is very common. It's going to happen to everybody during their lifetime eventually, because look, life is stressful. But again, we're here to assuage those concerns. But listen, thank you guys. I do want to just let everybody know that John and I can't wait for tomorrow. And John, you want to ask me why?
Carl, why can't you wait for tomorrow?
Well, the fact is that we get better looking every day. So thank you guys, and like and subscribe, and we'll see you in the next video.
See
So
you.
long.
Bye-bye.